So hello everyone. Today we will discuss myofunctional appliance, which is very important topic for the exam point of view, higher point of view. Okay. So keep your notebook and pen in front of you and keep writing. Okay. So let's study myofunctional appliance. Myofunctional appliance means myo means muscles and functional means the function of the muscles. So let's study the definitions. What is the definition means? The myofunctional appliance are loose fitting or passive appliance that utilize natural forces of muscles like tongue, lip, cheeks, facial muscles to guide jaw growth. Okay, yeah, these appliances are usually used during growing stage, and so these are the loose fitting. So these are passive appliances that the uh, appliances are inserted into the oral cavity in a loose fashion. Okay, these are the passive appliance means we will not have any screws components, spring components. Okay, so this functional appliance will work by natural forces of the musculature. Okay, so you have understood the definition and let's see the principles of actions. Actually ये कौन सा प्रिंसिपल पे काम करते हैं कि कौन सा प्रिंसिपल है जिसमें फंक्शनल अप्लायंस काम करते हैं. So let's see one by one. One is harnessing forces of facial muscles. Means the facial muscle, we have facial muscles and we will utilize the muscle forces of the muscles and we will apply to the functional appliance that will work and that will efficiently work and will correct the discrepancies. Okay, next is altering muscle function. So we have a muscle function, right? We have a tongue, we have lip, cheeks, right? So these muscles may not work properly, so we need to alter that functions so that the functions myofunctional appliance can work efficiently, right? So next is producing favorable changes in jaws and teeth. So same thing, so we have to changes the muscle functions into favorable one so that the function myofunctional appliance uh, can be work efficiently. Next is creating a new pattern of function that results in a new pattern. So we have to create a new pattern. So there was previously might be a different pattern of the muscles working. Now we have to create a new one so that according to which my function will work and the jaw discrepancies will correct. Okay. So what are the musculatures that work on the functional appliance? Okay, let's see there will be a tongue. Okay, tongue is there, lips, cheeks and facial muscles. Okay, the key point is change in the function. So we will change the functions of the muscles and there will be a change in growth. Okay, next. Now let's see a classification of myofunctional appliance. So myofunctional appliance have different categories. So there are different classifications. Let's go one by one. Basic classification of functional appliance. There are basic functions like there will have removable, we have a fixed and will semi-fixed. Okay, removable appliance means the appliances which can be inserted or removed by the patients at will. Okay, means the patient put under डाल भी सकते हैं और निकल भी सकते हैं, दैट इज रिमूवेबल. एंड इज वन इज फिक्स्ड, ये जो है फिक्स्ड जो है दैट इज इंसर्टेड बाय ऑर्थोडोंटिस्ट एंड यू कैन नॉट रिमूव बाय योरसेल्फ. ओके, पेशेंट खुद से निकाल नहीं सकते. इसका एग्जांपल है हाउस अप्लायंस और जास्पर जंपर. और रिमूवेबल का जो एग्जांपल है वो है एक्टिवेटर एंड फ्रैंकल. Now next one is semi-fixed functional appliance. Semi-fixed means few components are fixed and few components are not fixed. The main example is Danholtz. This is very important examples. Danholtz appliance is semi-fixed functional appliance. Now let's move to another classification given by Profit. Profit classified the myofunctional appliances as tooth-borne and tissue-borne. Okay, tooth-borne and tissue-borne. Tooth-borne means the functional appliance will contact with the tooth. Okay, directly walk into the teeth. Okay, now tissue-borne means the myofunctional appliances contact will be with the tissue, not the teeth. And one more is the tooth and tissue-borne means the functional appliance will contact with tooth as well as passive. As well as the tissue. Sorry. Okay, tooth-borne passive appliance means have no intrinsic force generating components and such as springs, screws. This is a passive appliance, so there will not have any springs, screws, etc. Okay, so in the example is activator, binator, halves appliance. Next is tooth-borne passive active appliance means okay, this will contact with the tooth, but there will be components that will act as a active components like springs and screws will be there. Okay, Next is tissue-borne appliances. This is mostly located in the vestibular area. So we have a vestibule, and this will be placed in the inside the vestibule, and it will work like this. Okay, the main example is functional regulator. Okay, next one is tooth and tissue-borne. I have already told that the tooth and tissue-borne appliances are actually contact with the tissue as well as the teeth. Okay, now let's study the next classification based on the transmission of force. So how the force is transmitted, based on which the um, classification is given. First one is group 1 appliances. Group 1 appliance means transmit the muscles force directly to the teeth for correction of malocclusions. Suppose we have inserted the myofunctional appliance, so that functional appliance will transmit the muscles force. Suppose my cheeks is I'm while swallowing and during chewing or during speech my cheeks will work, and this force will transmit to the teeth by this appliance. So this is called group 1 appliances, directly into the teeth. Remember the key point. Key point is this functional force will directly transmit into the teeth. It is group 1 appliance. Example, oral screen. Okay. Next is group appliance. Reposition the mandible, and the resultant force is transmitted to the teeth and other structures. Okay. First of all, we have to reposition the mandible. Okay, reposition the mandible. Suppose you have the retreated mandible, and we will reposition the mandible, forwardly position the mandible, and then these forces, then while chewing, or this forces will transmit to the to the teeth, and this structure is called, and this is appliances is called activator and bionator. Okay, now next one is group 3 appliances. Reposition the mandible, but their area of operation is the vestibule outside the dental arch. Okay, now group 3 appliances is saying that we will reposition the mandible, but it will not work on the dental arches, it will work on the vestibule or outside the dental arch. Okay, then example is frankel appliance or vestibular screen. Next one is classification into myotonic and myodynamic appliances. Myotonic appliances means the myofunctional appliance will work on the basis of the mass of the muscles. How much muscles are present? That is that will be the main focus on the appliances, myotonic appliances. And myodynamic appliances means this is myodynamic functional appliance that depend on the muscle activity. Okay, myotonic appliances is depend on the muscle mass, how much muscles is present. Okay, and myodynamic appliances is depend on the how the muscles is working. Okay, these are the classification. Okay, first one is for basic classification of functional appliances, that is removable, fixed and semi-fixed. Next is classification by profit, that is a tooth-borne passive appliance, tooth-borne active appliance, tissue-borne appliances, and both tooth and tissue-borne appliances. Examples are very important. Please remember the examples. Classification based on the transmission of force, there is a group 1 appliance, group 2 appliance, and group 3 appliance. Okay, classification of myotonic and myodynamic appliances. Now let's study the treatment principles. So actually during treatment, myofunctional appliance work on two main principles, that is force application and force elimination. मतलब ये है कि हमारा मस्कुलर जो है, हमारा मसल जो है, आइदर वो क्या करेगा, फोर्स अप्लाई करेगा उस फंक्शनल अप्लायंस में, और आइदर हम लोग क्या करेंगे, उस फोर्स को हम एलिमिनेट कर देंगे. तो ये दोनों जो प्रिंसिपल है, इसके ऊपर बेसिस करके वो जो फंक्शनल अप्लायंस है वो काम करता है. ठीक है, तो फोर्स एप्लीकेशन एंड फोर्स एलिमिनेशन, दिस इज वेरी इंपॉर्टेंट. ठीक है, अगर ये समझ लिया ना तो पूरा चैप्टर आसानी से समझ में आ जाएगा कि कौन सा अप्लायंस जो है फोर्स एलिमिनेट करता है और कौन सा अप्लायंस जो है फोर्स वो करता है, अप्लाई करने में हेल्प करता है. ठीक है, नाउ force application means compressive stress and strain act on the structures involved in result in primary alteration in form and secondary alteration in function. Most of the fixed or removable function appliance work on this principle. मतलब ये बोलता है कि ये जो मसल्स है, मसल्स क्या करता है, पहले क्या करता है, हमारा एक स्ट्रेस देता है. ठीक है, एक स्ट्रेस देता है, कॉम्प्रेसिव स्ट्रेस और स्ट्रेन देता है स्ट्रक्चर्स को. उसके बाद क्या होता है, प्राइमरी ऑल्टरेशन होता है. जैसे कि फॉर एग्जांपल एक पेशेंट है, पेशेंट का मेंटल जो है वो रिट्रूडेड है. ठीक है, हम लोग पेशेंट को रिलेटेड मैंडिबल है, तो क्या करना है, हम लोगों को मेनली वो जॉ को सामने लाना है, राइट। जॉ को अगर सामने लाना है तो हम लोग क्या करेंगे, हम लोग फोर्स अप्लाई करेंगे, फोर्स अप्लाई करके क्या करेंगे, मैंडिबल को सामने लाएंगे, राइट। मैंडिबल सामने लाने के बाद वो होगा प्राइमरी अल्ट्रेशन, कि हमने क्या किया, मैंडिबल को सामने लाया वो अप्लायंस से, ठीक है। लाने के बाद तो उसके लाने के बाद जो उसके बाद उसका जो मसल्स है वो एडप्ट करेगा उसके साथ, कि वो फॉरवर्डेड हो गया है अभी मसल, उसके हिसाब से एडप्ट करेगा ना, तो इसलिए उसको बोलते हैं सेकेंडरी एडप्टेशन, मतलब प्राइमरी अल्टरनेशन उसके बाद सेकेंडरी एडप्टेशन। Listen carefully once again, I am repeating. Compressive stress and strain act on the structures involved and result in primary alteration in form. That the form will change. Okay. पहले क्या होता है, पहले उसको चेंज करना पड़ेगा, प्राइमरी अल्टरेशन होना पड़ेगा, फिर क्या होगा उसके हिसाब से मसल क्या खुद को अडेप्ट करेगा, वो बोलता है सेकेंडरी एडेप्टेशन इन फंक्शन, फंक्शन में चेंज हो जाएगा। सो ये जो फोर्स एप्लीकेशन है मेनली कौन कौन काम करता है इसमें, फिक्स्ड और रिमूवेबल अप्लायंसेस इसमें बेसिकली काम करते हैं। Okay, next one is force elimination. Force elimination क्या होता है? This involves the elimination of abnormal or restrictive environmental influences on the dentition, thereby allowing optimal development. Thus, function is rehabilitation with secondary changes in form. ऐसा इसलिए बोला है, force elimination means suppose ऐसा है, suppose you have proclining incisors. A child has proclining incisors due to abnormal what to say, abnormal tongue thrusting. Okay, मतलब उसका जो टंग है वो टंग थ्रस्टिंग की वजह से उसका जो लोअर इंसिजर्स है वो प्रोक्लाइन हो रहा है, ठीक है। तो वो एब्नॉर्मल मसल फंक्शन है, तो हम लोग को क्या करना, कुछ ऐसा देना पड़ेगा कि वो जो टंग थ्रस्टिंग है वो कम हो जाए, है कि नहीं। तो टंग थ्रस्टिंग उसका जो प्रेशर है वो मिनिमाइज हो जाए और वो आसानी से वो अपने पोजिशन पे आ सके, जो लैटरल वो है इंसिजर अपराइट हो सके, ठीक है। नाउ लेट्स अंडरस्टैंड द components of functional appliances. What are the components? Components of functional appliances. These are bite plan, shield and screen, construction and working bite. Bite plans, actually bite plans are given for the eruption of tooth. Suppose we have suppose we need to erupt we need to erupt molars, so we will give the bite plans, okay, to erupt the molars, so to correct the overjet and overbite. So we'll give a shield screen. Shield screen means it's a barrier to eliminate the forces of the musculature. Okay. Next is construction bite, working bite. These are the construction or working bite. These are helps in the positioning of the mandible. This is the bite precision taken after positioning the mandibles forwardly. Okay. So many important points in this slide is functional appliance acts on two principles: force application and force elimination. They use simple components like bite planes, shield screens, and construction or working bite. And these components bring about skeletal and dental changes through eruption, muscle balance, and mandibular repositioning. So I hope you understand the components of the myofunctional plans. One is bite plan, one is shield screen, and construction bite. So what are the appliances we will study in this chapter is vestibular screen, lip bumper, activator, functional regulator, binator, उसके बाद twin block, half appliance, jasper and jumper. Okay, these are the myofunctional appliance we have to important. We have to study. These are very important appliances, and it's come in the 5 marks or 10 marks in the university exam. Okay, now today we will discuss the vestibular screen. Okay, vestibular screen is simple functional appliance taking the form of curved acrylic shield placed in the labial vestibule. So by name you have understand this is a vestibular screen. This is placed inside the vestibule so that the abnormal muscular force does not affect the tooth discrepancies or the abnormalities of the tooth. Okay, as you can see picture number A and picture B, this is the labial structure and the lingual structure, and this is the only labial structure. Okay, now vestibular screen is introduced by Neville in 1912. Okay, what are the principles, how actually it works? It can be used either to apply forces of the circummoral structure to certain teeth or to relieve those forces from the teeth. So this principle, these appliances can be used for the application of force or eliminating force. So we have understand this previously, that there are two principles for treatment, that is application of force and eliminating the force. The vestibular screens used either apply application of force or eliminating the force. Okay, it allows teeth to move dento-alveolarly or muscularly, or to tongue forces. Okay, thus it allows teeth to move due to the following forces: circumoral muscular forces, tongue forces, or combination of both. So if you see the diagram, you see the B. So this is the vestibular screen placed inside the vestibule between the labial aspect of the teeth and the cheeks. Okay, cheeks. Okay. Now you see the one additional components is added inside the lingual. So this components is used for the balance of the for avoiding the forces of the tongue, and this is used, and this components, the labial vestibular components, is used for the um, barrier, of the uh, muscular forces of the, that is lips. Okay, lips or chin area. Force application or force. This works on the principles of force application or force elimination. So in summary, if you see, the vestibular screen acts as by applying the circumoral muscular forces. We can apply the forces to the vestibular screen, and also we can relieving those forces, or we can just keep barrier the forces, thereby permitting normal and dental movement under the influence of tongue and other functional forces. Now, what are the indications of vestibular screen? Vestibular screen indications means habit interception. Habit interception. Suppose we have tongue sucking, tongue sucking habit. So, if we prescribe, or if we give the myofunctional appliance like vestibular screen, so it will act as a physical barrier. Okay. So just imagine you have tongue sucking habit. Okay. So now if I give you vestibular screen, so it will have in your mouth, right? So you will not you will not suck the thumb again. Okay, so this is why, or this is the way that your habit breaks actually. So mid-distal occlusions, and the patients who have a class 2 tendency. Class 2 tendency means the patients who have procline incisors. Okay, procline incisors means the patient who have lower lips of weak hypotonic muscle. You can say hypotonic lips. The lips is so weak that the abnormal pressure is falling into the teeth is very weak. So the incisors tends to move forward. So we give the vestibular screen so that the force act on the teeth, and the tendency of the class 2 becomes class 1. Okay. Muscle exercise for correction of hypotonic lips. Muscle exercise means, suppose you have lower, or you have weaker muscles of the lips, or hypotonic lips. Hypotonic means weak lips, means your muscles is very weak. So if your muscles is very weak, so your teeth will move forward. They have tendency to move forward. So we'll give a vestibular screen, and the patient will try to close the lips and competence the lip, right? That forces will help us to exercise the muscle, strengthen the muscles. Okay, muscles of lips. Next is lip and cheek bite. If patients have a tendency to biting the lips like this, and cheek, some people are used to bite the cheeks. So we'll give the vestibular screen so that their habit can be changed. Okay, mild anterior proclinations, muscle hyperactivity. If there is a muscle hyperactivity, so we will give vestibular screen, and the activity of the muscle high activity will be reduced. Next is mild anterior proclinations can be corrected. So if there is any anterior proclinations of the teeth, that also can be corrected. Now let's see fabrication of vestibular screen, how vestibular screen can be fabricated. So first of all, we will have to take impressions of the patients, and we have to pour the cast, and we have to make the models, and then we have to give we have the upper and lower both the models, and we have to occlude the models and by a plaster of Paris, and then we will extend the extend up to where muscles bolt outward. So we will extend the muscles. Now we will extension in sulcus. We extend up to where muscles bolt outward, not impinging frenum and muscle attachments. So we will extend it to the sulcus. Posterior extension, we will extend the posterior extension in the last lower molars. Okay, last molars, which is erupt. So we will uh, extend posteriorly to the last molars, okay, which is erupting. Next is wax relief. We will give the 2 to 3 wax relief. Material we will give self cure or heat cure material we will give. Next finishing. After that we will we will finish smooth and sandpaper and polish. Management and motivation of vestibular screen. There are many motivations are there. Management means how will you manage the appliances. Wait at night for 2 to 3 hours. Wait at night for 2 to 3 hours and 2 to 3 hours and during daytime. So you have to actually wear the at night time, but you can wear 2 to 3 hours in daytime also. Maintain lip seal. We have to maintain the lip seal. Because you have to wear the vestibular screen, but you are not sealing the lips, that will not work. You have to maintain always, keep your lips sealed. Initial days may cause irritation in the circular areas. First of all, in initial days, you may cause the irritation in the vestibular area because we have put the myofunctional appliances. Now, trim carefully to avoid tissue trauma. Okay, as means the vestibular skin should be trimmed or finished properly so that there will be no trauma into the tissue. There are three modifications of the vestibular screens. One is a horse modification. Horse modification is an oral screen fabricated with the metal ring projecting between the upper and lower lips used for various muscle exercises. Horse modification means there will be a vestibular screen and we will give the metal ring into the appliances. Now, next is for tongue thrust. So for tongue thrust, we have additional lingual screen attached to the vestibular screen. So if there is a tongue thrust inside the mouth cavity, so we'll give the for tongue thrust we will give the vestibular screen modifications. We give the another component inside the lingual area so that the tongue thrust can be avoided. For mouth breathers, we will give the vestibular screen is heavy with multiple holes. Mouth breather means, so we will give the multiple holes on the vestibular screen so that these holes air can pass through it. Okay, this is the end of the myofunctional appliance. Okay, we will next cover all the other myofunctional appliance like lead bumper, activator, functional regulator, binotor, twin block, all the functional appliance. So keep studying, and this is a very important topic in exam point of view and other point of view. And this I have covered all the important points of this myofunctional appliance. So subscribe the channel and share the channel with your friends so that they also get these good lectures, and subscribe the channel for more videos we will upload soon. Thank you.